what does experience really mean in terms of this type of law, and why is it important?
A main crux of the case is getting the right expert.
What's one mistake you think that people make in choosing a solicitor?
It's a bit like getting someone in to do some work in your house. You don't want someone that's readily available within a few weeks.
Yes, the best people are in demand, aren't they?
We are experts in this area. We only deal with clinical negligence cases, and we only act for, injured people.
What would you say to a client who feels nervous about starting a clinical negligence claim?
Most of our clients are already financially struggling. We're not going to ask for some money up front.
Hello, welcome to today's episode of Medical Negligence Matters. Today we're going to be talking about how experience of previous cases can assist and benefit future clients. And with me today is my friend and colleague, Jessica Wright. Hi, Jessica. Thanks for being here.
Hello, Gillian.
Hi. Now, just to start, a bit about you. How long have you been working in medical negligence, and what attracted you to this area of law in the first place?
So I've been qualified as solicitor now for nearly 15 years, and 12 years I've been practicing in clinical negligence. What drew me to that particular area was it's so rewarding being able to help clients go through and find out answers and hopefully give them access to justice about exactly what has gone wrong. And if we are successful with pursuing a claim for them, we can give them that financial security that I know will then sort of help with their future and make life a little bit easier.
Yeah, I think medical negligence is different, isn't it, from many other areas of law. I mean, I think that clients who've suffered from an injury during medical treatment have needs that are very different from those that have perhaps been involved in a road accident. Although the injuries are the same, it's from a lawyer's point of view, you're starting from a different place, aren't you, really?
Yes, you are. So sadly, a lot of our clients are coming to us already being unwell. They may have already been diagnosed with cancer that was always going to happen, and that in itself is a huge hurdle to sort of get your head round, with that diagnosis. But then they're coming to you because they're concerned that cancer diagnosis, for example, there's been a delay in the treatment, a delay in the diagnosis. So they're already struggling with, being unwell. And then they're concerned that, they've now, for example, got a terminal illness because of the delay. So they come to you quite angry and upset and, are quite demanding and want those answers.
Yeah, understandably, yeah.
Yes, because you have to put yourself in their position. If that was your mum or your child, you do have to sort of step back and take a breath and think, yes, I do understand why you're so angry. But you also have to try and show them that you're one team and you're there to try and help them and get those answers.
Actually, that leads me on to my next question, really. I was just thinking, for you, what does experience really mean in terms of this type of law, and why is it important?
Well, obviously, you all have to start somewhere. But over the years, I have picked up a lot of knowledge about how cases should be run. They are so different to any sort of like personal injury case. If you have a road traffic accident, just the whole length of the claim is completely different. A road traffic accident could be dealt with maybe within a couple of months or 6 months.
Yes, because often you're not really arguing about who's at fault there, are you really? And I think that's one of the key differences.
Yeah. However, with a clinical negligence case, there's so much sort of investigatory work that has to be done even before you know whether you've got a case. So some clients will sort of say, well, within a couple of months we might know if there's a case. But again, my experience has taught me that a main crux of the case is getting the right expert. We need an expert that is going to be still in NHS practice, because you want someone that's current. You don't want someone that's been retired 5-10 years and is completely, out of the loop with current guidance and actually what is happening on the ground in hospitals, because it's all very well having guidance, but sometimes, practically it can't just happen for whatever reason. So I've learnt that getting the right expert is key. It's a bit like getting someone in to do some work in your house. You don't want someone that's readily available within a few weeks. You know, we sometimes have to get experts that have got long waiting lists, and I'd rather wait for a good expert report.
Yes, the best people are in demand,
Exactly,
aren't they? And of course,
yes.
yeah, you're right. The getting of the expert evidence is such an important part. Well, it's the crucial part
Yes,
in any
yes.
clinical negligence case, isn't it? And thinking about sort of experience, has been over the years, I mean, you must have dealt with very many cases. And how, in your view, how does one case that you've dealt with in the past help another? I mean, do you think certain patterns emerge over time?
Yes. So, for example, you know, you'll never probably get a case exactly like for like, but you sort of have the same issues cropping up in cases. So if it's a delay in diagnosis of breast cancer, I will know potentially what, you know, discipline of expert to go to. Also, some experts will give different opinions. And for example, there could be future risks that I'm aware of a different case, but actually my current expert in that particular case that I'm dealing with hasn't dealt with that. So for example, from a previous case, I might know that there's a risk of, say, future lymphedema, which if that particular client got that condition, it's really just debilitating in the future. So if my particular expert hasn't dealt with it, I've got the confidence to go back to that expert and say, well, actually, you know, risk of lymphedema, for example, is that something that this client should be advised of?
Yeah, that's a very good point, isn't it? Because although each case is unique, isn't it? And each client's circumstances are unique to that individual. But of course, the benefit of having dealt with lots of cases is you do see the same, you see the same areas of medicine or possibly the same failures occurring. And it's the experience of having seen lots of expert reports in that area will flag up questions, which I suppose if you'd never dealt with that sort of case before, you might not spot.
Yeah. So, for example, you know, people would have seen over the news over the last few years, like, for example, the rogue breast surgeon Ian Patterson, you know, he was obviously, you know, that was sort of an issue that kept coming up. And just because we deal with a lot of local hospitals, in our experience, we were aware that there was a lot of senior midwives that were retiring, that then left a lot of junior midwives, you know, delivering babies. They maybe haven't got that gut feeling of maybe when something's going wrong. And we did seem a bit of an influx with inquiries, with people, you know, a bit concerned that things went wrong during their delivery.
Yes, I think that's very important, isn't it? Is that the knowledge of context,
yes,
in which medical treatment is being given, things that are happening in local hospitals, that sort of thing. That's really important. Can you think of any particular thing or an experience where something that you've learned from one case has helped another client?
I think what's helpful is you can get a report that gives you, you know, failings in care, and a client will think, right, brilliant, you know, that's the end of the case, but it's not. It's the very beginning, and it's making sure with your expert that you've got that link with the failings in care have then resulted in that person suffering an injury. And as we touched upon earlier, you know, your clients are coming to you feeling that are already unwell in the first place or already have some sort of injury. And it's differentiating between, well, what would have happened in any event compared to, you know, identifying those losses and the injuries that they now have because of those failings. Yes,
and I think that's what you've hit the nail on the head here. One of the key differences, isn't it, between clinical negligence and other types of accident cases is most of the time in our cases you've got someone who's got some sort of disease process going on in the first place, and trying to untie how that disease itself would have progressed in any event, or with or without the treatment, and how any failings in the treatment has made that difference. And do you think that, I suppose it's difficult to think back now, how the knowledge you had when you started, obviously you've just accumulated a huge amount of knowledge since then. I mean, how do you think has that affected your practice, or does it affect the way you look at cases or how you spot things in cases?
Yeah, I think I'm more aware of, like, for example, when I'm reviewing medical records, maybe when I first started practicing this area, I would be looking at the records and sort of be quite dismissive about maybe pre-existing conditions and think, oh, that's not really relevant. Whereas as I've read more expert reports that cover so many different, areas, as I'm going through records, for example, certain conditions will be on my radar that might actually affect, the client's overall prognosis, which obviously affects the value of the claim and things like that. And I'm also quite confident with, going back to experts and asking particular questions. Because again, sometimes if you're not an experienced lawyer, you might just take that expert report as face value. You might just see the opinion section, but actually experts can sometimes overlook things as well. So it's important to be really thorough and cross-reference things. I think before I was maybe naive about double-checking things, and you think, well, if a barrister's, for example, said that, it must be right. But it's for us to double-check everything and have the confidence to speak to the client about certain things that maybe they haven't told you at the outset of the case.
Having confidence in your own judgments about things, isn't it? And actually, just going back a moment, the medical records point, I think that's a very interesting one, because it's so important, isn't it, in our work, that the medical records form the key factual evidence in a case, don't they, really? And it's so important for the individual lawyer to get to grips with what is in those records.
Yeah.
And that can be quite challenging, because sometimes there's thousands and thousands of pages. So, how do you manage that?
Well, when we get the records, which can sometimes sadly take several months, they will be in a right mess. They don't come to us all sorted and paginated. So we have a company that will do that for us, and then I will go through the records.
And you go through every single page?
We go through every single page. Yes, there could be thousands of pages, and sometimes there is duplication, but it is important to go through every single page, because there could just be a slight 2 or 3 words on that particular bit of record that actually is relevant to the case.
Yes, there might be just one tiny entry that is the key.
Yeah, or even a tick in a box. It could be anything. And again, I think once I've reviewed the records, I normally have a meeting with the client to discuss those records as well. So again...
So the client sees the records?
Yeah, the client sees the records. And again, for my own peace of mind, if the client's asking me questions about those records, I can say with confidence, I have gone through your records, and I know, for example, that isn't in there, or no, this is what is recorded in your records. And that, again, my experience over the years is it's being able to have those conversations with the client, because they could be adamant that this is what they told the doctor, but you sometimes have to have those tricky conversations, say, well, actually, your records say something else.
It's difficult, isn't it? Because I know clients' recollection of things, no matter how sort of strongly felt, isn't necessarily correct.
Yeah.
I mean, the mind sometimes plays tricks, and it is very difficult to navigate that route between, what the client believes happened and what is recorded as happening. And the difficulty is, of course, that the records are made mostly contemporaneously, aren't they? So it can be quite difficult to argue that what is written in a record is not what actually happened.
Yeah.
And there has to be very compelling evidence to try and sort of displace that.
Yeah.
And actually, I was really interested in what you were saying about analysing expert evidence, because again, I think that is something, as you say, that really only comes with experience and the confidence, is because the experts don't always get it right first time, do they?
No. And experts, they sometimes like to be too helpful. Or
they think they're being helpful.
They think they're being helpful. And again, they sometimes like to talk about things or give opinions that is outside of their area of expertise. And again, at face value, as maybe someone less qualified, I might just think, oh, that's them being really helpful. Thank you very much. That saves me time getting another expert report. But actually, over the years, I've learned that no, you might need another expert report that deals specifically with that issue. It could just be quite a small point, but actually, if it builds your case, it doesn't matter. You do need another expert report. So
yeah, and the confidence that comes from experience enables you to be more critical, I guess, and not just, say, take at face value one way or another what an expert is saying, but actually being able to really think about whether what they're saying is correct.
Yeah, and again, a client will sort of say, well, why do we need another expert report? And again, going back, having the experience, you can explain why it is important and try and reassure them that, you know, it's taking a bit of time. It might take longer than they want it to, but it's so important that we get our case, you know, factually correct. We've got all our ducks in a row effectively, and we put our best case possible to the defendant, because if we don't fully investigate it and we then chuck in allegations, you know, piecemeal, again, it sort of deflects and detracts from, you know, that we think we've got a good...
Doesn't it, really? Yeah. And thinking about how, you know, interactions with a client, do you think that the experience that you've gained over the years has changed the way that you can sort of deal with clients' emotional demands as well as their need for sort of legal advice?
Yeah, I think it's really difficult because some of your clients may never have met a solicitor before. So it's really daunting. They don't know. They maybe have an impression of what solicitors should be like. So I think it's so important to build that rapport with that client and show them that, you know, you are a team, you know, we are working together to get answers. And, you know, as my experience, you know, as I've gained the experience, I felt confident to be able to have, for example, difficult conversations with clients, because sometimes sometimes to say to them that, you know, we've got an unsupportive report for this particular part of the case, or sometimes I'm having to deliver news to them that they have no idea about. So, for example, it could be about their prognosis, their life expectancy, and you'd expect maybe some people with a terminal illness to know that already from their treating doctor, but you soon realise that they haven't been told that information. So again, it's having that empathy to be able to say to them, you know, look, I've got this report. Do you want to know what it says? Or I can just tell you and you don't have to see the report at this stage. And it's, again, just getting that client to sort of trust you as well. And with the cases I've dealt with over the years, you sort of pick up on terminology. So, for example, if they're having cancer treatment, you know that it's like cycles of chemotherapy. So if you start talking about some medical terms that you know that they'll be aware of, it just, I think it gives them that confidence that you know what you're doing.
Yes, you're not sort of, I don't know, staggering around in the dark or something.
Yeah.
And actually that leads me on to my next point, actually, really, is how do you think your experience helps you to reassure clients? I think probably actually you've already really dealt with that, isn't it? It's having the expertise that you can demonstrate to clients.
Yes, I think, you know, it's a difficult one because for each client, their story is so important to them, and I'm not deflecting from what they've gone through, but I will always sort of say to them, look, you know, I've dealt with similar cases, sadly. You know, obviously I don't go into, you know, full details because of confidentiality, but just to show them that, you know, we are experts in this area. We only deal with clinical negligence cases and we only act for, you know, injured people. So if I sort of say to them, you know, I've dealt with similar cases, that then might help give them confidence that, you know, I know what experts to obtain, and, you know, it just sort of helps them, just give them the reassurance, really. Yeah,
and I think that for clients to know that you've helped other people in a similar circumstance get positive outcomes, then that hopefully will give them some confidence. Is there anything in particular that you think that you would notice now about cases that you perhaps wouldn't have done at the beginning of your career?
I think I'm more alive to... So you get a report that gives you failings in care, and then you might get a report that says, well, those failings resulted in this particular injury. But you're also missing sort of a middle bit that, well, what would have happened in terms of getting to that diagnosis? So it's called sort of factual causation. So, you know, a scan might have been misreported, but then we need to look at, well, when would it have been reported correctly? would further tests maybe have had to have been done to get to that eventual diagnosis. So that's probably more on my radar, that you've still got that factual causation element.
Yeah, that's an interesting point, isn't it? Because I think a lot of what we do, and yes, a lot of our cases relate not necessarily to things that have been done wrong, but to things that have been missed. Mm-hmm. And then so much of our case and our investigation is to do with, working out that hypothetical, isn't it? Okay, so we know something should have been done differently at this point. A scan should have been interpreted differently, but then what would have happened?
Exactly.
And so you're creating you have to build an alternative timeline, really. And that's, that can be quite difficult.
It can be, and that's again when you might need other discipline of experts to help you with that timeline. And again, there could have been something going on at that particular hospital, so at that particular time. So a routine scan might take a week, but they might have had delays, so actually it was a month. And you can't ignore that.
Exactly. Yeah, you're quite right. So this is where the hospitals might make sort of resources arguments. So we didn't have scanners available on particular days of the week or this, that. So yes, you have to establish what would have actually happened on the balance of probabilities, more likely than not.
Yeah.
Just thinking finally about what's one mistake you think that people make in choosing a solicitor?
I think some people might be swayed by a fancy website. They might sort of look at reviews, or they might not be that current. So I think a lot of people might go for a firm that say they do clinical negligence, but they sort of do a bit of clinical negligence. And I'm not, they may be very, very good, but coming back to particularly us as a firm, we specialise in clinical negligence. We don't do any other work. My whole day is spent only dealing with clinical negligence cases. So I think some clients, they might go to a firm that looks the part, but actually they haven't got that experience.
It is difficult, isn't it? Because you touched on this earlier, I think, that most people have very little contact with solicitors, thankfully, during the course of their life. I mean, they might move house and have a solicitor do conveyancing or this sort of thing, but most people don't have much contact with the legal profession and don't want to. And so finding a solicitor can actually be quite a challenging thing, can't it? Because you don't necessarily know who deals with what sort of cases. And of course, if you just go into the nearest firm that you come across on the high street, they may well be very good at doing wills and doing conveyancing, but they wouldn't necessarily know about the specialist nature of clinical negligence work. And so I suppose it's not... Yes, it's choosing the right solicitor and choosing somebody who's got genuine experience in the thing that you...
Yeah, and I think, some potential clients will come to us saying, for a funding issue, for example, well, they've asked for money up front. Well, that we would just never do that. We act under a no-win, no-fee agreement. Most of our clients are already financially struggling. We're not going to ask for some money up front. So, it's also the funding issues aside. We know that we've got certain, accreditation, for example. Some people that might not even be on their radar, but, we're APAW accredited, Law Society accredited, some of our lawyers. And again, it's helpful, I think, when you're choosing a solicitor, there can be like recent case studies that they've dealt with. So you actually get a flavour of the cases that they're looking at, which can be quite helpful.
We've talked a lot about sort of the complexities and some of the difficulties in pursuing cases. What would you say to a client who feels nervous about starting a clinical negligence claim?
Yeah, so the solicitors at Gadsby Wicks are very approachable and friendly. We have a huge area of expertise which will hopefully put the clients, at ease. And some clients will feel very anxious about seeking legal advice, particularly because they're probably still having treatment at the particular hospital. So again, it's just reassuring them that the hospital's not going to blacklist you, for example, just because you're seeking advice. So just to reassure them that, if they are concerned that they're being treated differently, they can get a second opinion, they can be referred to another hospital. And obviously, because we've acted for thousands of clients over the 30 years that the firm's actually been going, they're not the first to do this. So, you know, it's fine to seek this advice.
And we know how to help them.
Exactly.
And financially, they're not at any risk.
No, they're not at any risk. And again, I hope that once they've actually met their lawyer, they will feel at ease and have confidence going forward and be kept updated with each step of the case.
That's right. There's a specialist team on their side
Exactly.
that can help them achieve the outcome that they want. That's great. Thanks very much, Jess, for all your time today. It's been really helpful. Thank you.